And thanks for staying with us. Type 2 diabetes is a major public health problem, but many patients do need medication to control that blood sugar. Sometimes it can be hard to figure out what drug is the best for treatment. And joining us live this midday, Dr. William Sivitz. He's a UI endocrinologist and professor of internal medicine. So thanks for joining us today. We appreciate it. And this is a major problem, as we mentioned, but what's the prevalence of this disease? Is it?
Well, it's very common. About 7%, 7 to 8% of population of the United States have it. That's about 21 million people. Plus, many people have type 2 diabetes and it hasn't yet been diagnosed. So we think the actual incidence or prevalence, I should say, is more like 29 million.
So what are the symptoms that people should be looking out for?
Sometimes type 2 diabetes can present without symptoms.
Really?
And it takes a blood sugar to identify it. When it progresses, then they can get thirsty and start to urinate more as they try to pass the glucose through the urine and just not feel well, no energy.
So it might take a while before you realize you have a problem.
Oh, yeah, absolutely.
Okay. Now, you are administering a study at the University of Iowa to kind of address some of the medication problems that can go along with type 2. Can you tell us about that?
Yes, type 2 diabetes is first treated with nutrition and exercise advice. When that's not enough, common practice is to use a drug called metformin. After that, it's not clear what the next treatment should be. So we really don't know. The Food and Drug Administration has approved several drugs for the treatment of type 2 diabetes, but we really don't know what is best, which drug is best, not only to lower the glucose, but to prevent the worsening of type 2 diabetes that we know occurs gradually over time. Therefore, the National Institute of Health has organized and is sponsoring a study called the GRADE study, which is designed to answer that question.
Okay.
The University of Iowa is one of 37 medical centers participating in the GRADE study, G-R-A-D-E.
And who are you looking for to be a part of this study?
Participants have to have diabetes for less than 10 years. They need to be taking metformin as the only drug for diabetes, and also need to have an average blood sugar that's in the range where further treatment is warranted.
Okay, so that would be something that you would need to talk to your doctor about, and then if you meet those requirements,
absolutely
come to you.
Yes,
probably.
Yes.
And where can people get more information if they'd like to be involved in the study or just know more about type 2 diabetes?
Sure. Well, the way to contact us in the study is to call 319-384-8103. I think that's a number on the screen, hopefully.
Yes, yep.
Or another way to do it is to just go on the internet and search for GRADE, G-R-A-D-E study.
Okay. You can find information about all the different drugs that you're testing, and
it's pretty detailed. There's a website there that gives people the information they would probably like to see.
Well, obviously, as you mentioned, this affects millions upon millions
Absolutely.
of people. So, Dr. Sivitz, we appreciate your time. Check out the GRADE study or call that number. Thank you so much for being here today.
Thank you for having me.
And we'll be right back with another check of your First Alert forecast. Stay with us here on TV9.